Welcome, everybody, to the first edition of the Francis Worldwide Podcast. I'm your host, Jay Bowen, with the lovely Mamie Kyle. Today, we have a special guest for you today, Dr. Stephen Baker of the Psychology Department, and he's here to talk to us about his field and his involvement with breast cancer awareness, given that October is the month of breast cancer awareness. Great to have you on the show, sir.
Thank you for the invitation.
All right, let's just jump right into it. So, first question for you. Why did you choose the field of psychology, and how did that relate to getting involved in breast cancer awareness?
So it's a kind of a long story and I'll make it shorter. When I graduated high school, I just knew that I wanted to work in psychology, work pretty much in clinical psychology. As I was going through my courses, it kind of changed. So after I graduated from Rhode Island College with my psychology and my education English degree, I went off to Catholic University and got my first graduate degree in clinical psychology. And it's at that point that I started to go work for Johns Hopkins University in their psychiatry department. And as I was working there, I realized that I started to enjoy doing more research than the clinical work. I also started to teach psychology at a local community college and really loved the teaching aspect. So I kind of shifted my focus a little bit. And that led me to going to University of Houston, where I worked on my PhD in developmental psychology. And my mentor at that time was a recent breast cancer survivor. And she was just coming back from treatment, and she was kind of developing this new idea of bringing all the various disciplines of psychology together around this one area of cancer survivorship. For her, it was particular to breast cancer survivorship. Mm-hmm. So I really went to the University of Houston wanting to study developmental psychology and to work on my PhD. Working with her, I became interested in cancer survivorship and breast cancer survivorship.
Was there any family influence in that, or was that mainly her specifically?
It was mainly her specifically, but there is a family influence. So my sister had breast cancer and uterine cancer, mm-hmm. And my father had breast cancer, which is mm-hmm. rather rare. Most of the focus is on female breast cancer, but about 1% of the male population develops breast cancer.
Mm-hmm. I remember back whenever my grandmother had one of those scares. They caught it early on, so they were able to remove it before it got any worse. But as for that, what compelled you to continue the process, and what can you offer for people currently experiencing breast cancer today?
So as I said, my mentor, Dr. Mary Noss, really came back from her breast cancer treatment and gathered together this research group that cut across all the disciplines of psychology and really got us talking together and really focusing in on the survivor and how we take our knowledge and how we apply it to better understand survivorship. So when I first came here to St. Francis University, I noticed very obviously our health science programs and how wonderful they are, how successful. And I looked at that, I thought, well, this is perfect. I can come in here and instead of just kind of limiting ourselves to psychology discipline, really cutting across the different health science fields all around cancer. That took a while. And it really was Dr. Steve LaRusso from Exercise Physiology who brought together myself and Dr. Ivan Mulligan from Physical Therapy. He mentioned this idea of a cancer care program. It was perfect. It fit my past experience. And from there, during the last 5 years, we've created the Center for Rural Cancer Survivorship, which includes the master's degree in cancer care with a focus on exercise physiology.
Oh, fantastic. All right, with that in mind, we're going to take a quick break with our sponsor. We'll be back to you after these short messages.
All right, hi, I'm Mamie Kyle, as mentioned before, and I'll be hosting the second portion of the Francis Worldwide podcast. So, as always, Dr. Stephen Baker is back with us. And let's get started on the second set of questions.
Great.
Right. So, what do you think is the best age to get screened for breast cancer?
Great question. So, obviously the first recommendation is you need to have a conversation with your primary care physician or your OBGYN doctor. They know you best, so they can give you the best advice. However, the Center for Disease Control, the National Cancer Association, American Cancer Society, National Cancer Institute pretty much say that somewhere between age 40 and 44 you should start to have this conversation. The opportunity should be available to you to have mammograms, but at 45 up until age 45 up until age about 54 you really should have a mammogram once a year. After 54 years old, 55 and above, the recommendation is every 2 years. Rather, obviously, you should be doing self-breast examinations so that you know your breast the most intimately, so you can detect abnormalities and bring this to your PCP.
Thank you.
Mm-hmm.
And then, how has the treatment of breast cancer changed over the years?
Once again, the advancements in our detections and our treatments have greatly improved. Pretty much the standard treatment still is going to be surgery, radiation, and chemotherapy. Chemotherapy and radiation, both have side effects that go with it. Conversation with your oncologist can really detail those side effects because depending on the type of chemotherapy that is used can alter that. But the newer chemotherapies have less toxic side effects. However, one of the concerns that has come out is that some of the chemotherapeutic agents can damage the heart. And sometimes this heart damage is subtle and does not show up for 5 or 10 years post-treatment. And that has been a concern. One of the things that we do at our Evergreen Exercise Clinic is we provide exercise to help cancer survivors return to a state of functionality. Exercise helps with issues of fatigue. Exercise helps with issues of chemobrain or cognitive fog. Exercise actually has been shown in research to help while the individual is going through chemotherapy. So by engaging in exercise and increasing your functionality and mobility, this is a benefit to you. It also strengthens your heart. As I was saying with the other question, as we're looking at those ages at which mammograms become important, one of the other aspects is you have an individual who is aging, and one of the other concerns about a chronic illness is heart disease. So you kind of have this situation in which you have this potentially naturally occurring heart disease, and then you add the cancer and the chemotherapy, and you need to be more concerned about that.
And how long has the Evergreen Clinic been offering these services?
We have been offering these services for 2 years. Right now, we are offering these services at a minimal cost to the clients. Unfortunately, health insurance is not at this point paying for these services. But what you actually get from coming to the Evergreen Exercise Clinic is a very detailed evaluation as to your current state of physical activity, and then a prescription by a certified exercise physiologist as to how to improve your physical activity level by coming to the Evergreen Exercise Clinic. What you end up having is a thorough evaluation by a certified exercise physiologist, and a prescription for how you can improve your physical activity level in a safe manner. So this isn't simply, we want you to go to the gym and exercise, but we're going to be with you. You actually have a personal trainer during the course of your treatment here. We monitor you, we reevaluate you, and then upon graduation, we give you a discharge plan. So here's how you can continue it. We've been doing this for 2 years, as I said, and a number of our clients return back because they, one, saw a benefit to it, but they also like the kind of the social friendship that comes with this.
And that's amazing in general, especially that, they come back because you make them feel welcome.
We do. There is, they come in typically 3 times a week. They're working with this personal trainer. It's one-on-one. So there is a bond that connects here between the survivor and our cancer care students and our professionals there. And that's an important aspect to treatment. You're feeling isolated and confused. Here is someone who has an understanding of cancer in general and the treatment, but also has a concern for you as the survivor.
And then our last question for today, what are the chances of breast cancer coming back after about 5 years?
So 5 years tends to be that critical point post-treatment. If there is no reoccurrence within those 5 years, then generally the cancer has been removed, and you can be less anxious about it coming back. The reality is, if cancer was there once, then the chances of it coming back are great, and that's why you continue to see your oncologist, you continue to do your annual evaluation, listening to your body, because most cancer survivors kind of feel cheated by their body. They've had this tumor growing and they didn't realize it. So they tend to become more hypersensitive, which isn't necessarily bad, but remember to have that communication with your oncologist and your PCP.
Yes, communication is definitely the key.
Yes.
In this especially. All right, so we just want to thank you for coming on the show, and thanks to our listeners as well.
Great. Thank you for having me.
We'll see you guys in the next edition.